I want to tell you a story about a carrot, an egg, and a coffee bean. These three seemingly random items have completely different reactions when you place them in hot water. The carrot, when you boil it, it loses its form and becomes soft and mushy. The egg, when you boil it, it becomes hard and loses its flavor. But for the coffee bean, it changes the water around it. The end product, after it's been boiled, is better than when you started. It is my great honor to be talking to the nearly 3,000 addiction providers at this ASAM National Conference this year. And in a way, we are also being boiled. We are under constant stress to perform, stress to save lives, stress to change the environment around us. It is my great hope that after these presentations and after this conference, when you go home, we can elicit in you to be the very best coffee bean that you can be. Let's get started. Do not have any relevant disclosures. Concerning learning objectives, I'm basically going to be talking about Tennessee's advocacy efforts, and I'm going to give you some advanced tips on how to get a seat at the policy table for addiction medicine. Concerning Tennessee specifically, Tennessee can be very restrictive in relation to its regulations and its laws. For example, mid-level providers in Tennessee have a lot of prescriptive authority issues. They can only prescribe a max of 16 milligrams of buprenorphine. They are not allowed to prescribe benzodiazepines to patients that are on MAT. And they're not allowed to prescribe monotherapy buprenorphine under any circumstances. Tennessee State Medicaid, commonly known as Medicare or TennCare, also does not pay for greater than 16 milligrams of buprenorphine per day. TennSAM is very involved in advocacy, and specifically, we've supported a lot of bills over the years. Some of the more recent bills in the last few sessions that we've supported include MOUD initiation by a telehealth that would codify that an in-person examination would not be required to initiate MOUD. We've also supported correctional facility prescribing that would allow mid-level providers to prescribe buprenorphine in Tennessee's correctional facilities. Of note, incarcerated individuals are 129 times more likely to die of an overdose within 2 weeks of their release. We've also supported an alcohol Good Samaritan bill that expands immunity when assisting a person experiencing an overdose from alcohol. We previously had that for drugs, the Drug Good Samaritan bill in Tennessee, but we did not have that for alcohol. So when you go back to your state, you may want to find out this may be something you want to sponsor in your state as well if they don't have that. TennSAM also works with the Tennessee Department of Mental Health and Substance Abuse Services. They've recently come out with their new OBOT and OTP rules, and we made recommendations to the chairman of that department. And some of those included requesting reconsideration of dosing standards for buprenorphine in the age of high-potency synthetic opioids and dosing caps for methadone in OTPs. TennSAM also collaborates with Medicaid, state Medicaid. We've worked with the chief medical officer, the employee that works for Tennessee government under Medicaid. And we've had some issues as OBOTs and OTPs in relation to Tennessee's MCOs, managed care organizations, individually do not consistently follow the same standards. One example is concerning connected counseling. Some would require a connected counseling visit to be on the same day. Others would allow it to be within 7 days, the one that's connected to a provider encounter. Since we've talked to state Medicaid, we've gotten them all to align, and they're all now using within 7 days. Let's shift gears now to mastering the how of effective advocacy. Teaming up with a lobbyist is one of the best ways to learn the ropes of advocacy. Connecting with your state AMA chapter can also be very beneficial as they have more resources, including lobbyists, that you can access. Networking is also very important because you're gonna have to connect with legislators to get sponsors. So going to AMA events, going to other organizations' events, but in the end, you have to get the ears of legislators. Also, you wanna make sure to find out what the deadline for filing bills in your state is, because you have to secure sponsors way before that. So how do you secure a sponsor? You're gonna need both a House and a Senate sponsor to sponsor your bill, right? The sooner you can get them, the better. Ideally, like in the summer or the fall, prior to the next year's session. The session in Tennessee lasts from late January to early May. Who you target as a sponsor can determine whether your bill succeeds. I would recommend targeting Health Care Committee members of the majority party, as they have more members on each committee and are less likely to vote against fellow committee members of their own party. Going to your state AMA chapter events like Doctor's Day on the Hill, I think could also be very important. That's one of the ways that I connected with one of the recent legislators that sponsored one of my bills. So how do you craft your bill? You'll need to craft your bill, and if you're on a deadline, you can get legal to craft what's called a caption bill. That's basically a placeholder bill that you'll subsequently file an amendment to, which is what you're really gonna do, right? Once you've created your bill, you can ask the legislative assistant of your sponsor to get legal to edit your bill for you and to format it correctly for you. They'll then send it back to your sponsors, get them to sign it. It'll then go to calendar committee and then eventually go to one of the committees that it gets assigned to. You also want to find out if any of your legislators have bill limits. In Tennessee House representatives have a 10-bill limit. And because of that, if you get to them too late in the game, they're probably already gonna be full. You're also gonna have to create what's called a one-pager. A one-pager is basically a way to persuade members to support your bill. It's basically a short summary of what the bill does, and it basically encapsulates your talking points. You wanna include all the information at the bottom there. Specifically, you also wanna include your contact information, your name and contact information, to provide witness testimony or to answer any questions that legislators may have. Here's some bill success strategies. You definitely want to identify potential opposition. Sometimes that might be a competitor, sometimes that may be a state agency like law enforcement or the Department of Health. But if you can sit down with your opposition, talk to them, try to get them to support your bill, your idea. And even if they're not going to support it, if you can get them to remain neutral, that's a win. Getting other organizations to sign onto your bill is also very important. For instance, some powerful organizations might be your state AMA chapter or your state hospital association. So you've got a bill, you've gotten legal. Those are basically the attorneys that work at the Capitol for the government. They've edited it, they formatted it, your sponsors have signed the bill. It's gone to calendar committee, it's gone to committee now, it's been placed on, I don't know, let's just say April 1st to be in healthcare committee. You then get on your state capitol's website. You need to learn how to navigate that website. It's very, very important because you're gonna have to target specific legislators, right? And you wanna target the committee members of where your bill is gonna be heard. So for instance, this is the state House Sub-Health Committee. You can print this off. And you want to get to know the legislative assistant. They're basically the gatekeeper to the legislator in relation to getting appointments. You want to schedule your appointments in person. So you want to go to the legislative office. The legislative assistant's the front office person. And then you want to try to get an appointment with them. In relation to when to schedule your meetings, you want to schedule your meetings ideally close to when your bill is going to be heard in their committee. If you schedule your meetings months in advance, they're gonna forget about what you talked about. So if you could ideally get the morning that your bill goes to their committee, appointments with those committee members, Everything's gonna be fresh on their minds, the talking points that you talk to them about. You also wanna do some research and gauge potential support of legislators. You can get on the website, the Capitol's website, and look at past bills that they previously passed, or see if you can find some other addiction bills that maybe they voted no on, to try to gauge if they're gonna be support or oppose your bill, to come up with talking points and a strategy when you talk to them. When you do talk to them, you start off by mentioning the bill number. There's two bill numbers. There's a House bill number, HB 1234, and a Senate bill number. So if you're talking to the House guys, you mention the HB number. If you talk to the Senate guys, you mention the SB number, Senate bill number. And when you talk to them, you basically go over your talking points. You leave your one pager with them. You want to gauge their support. You make the ask of whether they're willing to support your bill, and you thank them for their time when you get done. So what do you do if you can't get an appointment? I learned this from a lobbyist. That's right, it's time to loiter and stalk. So what is loitering? Loitering is, you didn't get an appointment with them, but you still have to talk to them, right? So you go to their office, you ask the legislative assistant, this is where the relationship pays off. You say, hey, can I hang out, till Representative Smith gets done with her next appointment, and just briefly talk to them for a few minutes, just grab them, mention something to them. You may have to sit in the office for like 30 minutes, so you have to be patient, but ultimately you'll be able to talk to them, but you want to be brief when you do talk to them. So what is stalking? So you'll see lobbyists hanging out, playing on their cell phones, in the hallway next to some powerful legislator. What are they doing? They're waiting for the legislator to come out of their office. That's what they're doing. So as soon as they come out of their office, oh, hey, I just wanted to mention HB, blah, 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 quick talking points, but you want to be very, very brief in these scenarios. You can also target people like in the lunchroom, but that's kind of lobbyist talk there. Concerning witness testimony, you're the best expert to talk about your bill, right? Your sponsor probably knows very little about it. So some things about witness testimony that you need to be aware of. Frequently there are required forms, like electronic forms that you have to fill out. So you want to fill those things out before you give witness testimony in a committee. You also want to find out what the time limit for your initial statement is. So I'll tell a quick story of myself, but I was told I had 3 minutes to talk at one of the committees by one of the lobbyists. I was like, all right, great. I kept timing myself, 2 minutes, 20 seconds, 2 minutes, 20 seconds. 2 minutes and 5 seconds go by in the committee when I'm giving witness testimony, and the chairman cuts me off. I'm like, oh man. It was 2 minutes, not 3 minutes. What do you say to him? You could say something to the effect of in your initial statement of, thank you, honorable chairman and fellow committee members. Summarize your bill, and once you're done, thanks for your consideration, and I'm available for any questions that you may have. If they do ask follow-up questions, there's no time limit on that. This is a pretty busy slide. These are the steps in Tennessee to pass a bill, but I just want to note that the House, you have to go through a House subcommittee, then a full committee, and in the Senate, it's just one committee. So you have to go through 3 committees before the bill's even ever heard on the House floor or the Senate floor. So, and then it goes to the speakers, then it goes to the governor, and if it fails in any of those steps, the bill dies. That's why there's a term called bills die in committee, because most bills do die in committee. Some final takeaways: trying to push a bill can be a very time-consuming process. It's likely going to require multiple days off from work each week your bill is up for a vote. And the legislature can also be kind of a zoo when they're in session. When they're not in session, it's like a ghost town there. But you need to have realistic expectations as well. The first time you try to push a bill, it's not likely to pass. But don't get discouraged. You can learn from that experience, and each time you push another bill, it's going to have a higher chance of success because of your own experience. You also want to make sure to thank your sponsors, send them a handwritten thank you note at the end. So now, having said all of that, if all my presentation today has made you thirsty for coffee, that's okay. Later on today, I'll be at one of the coffee bars and be happy to answer any questions you have and buy you a cup of coffee. Thank you.